Thank you for the opportunity to be here at your conference. It's really good to be able to share information about what we're doing at CQC, my ambition for what we should be doing, and also to reflect on some of the challenges. And I'm sorry I didn't get here for the beginning of the conference, but I was very interested by the panel on integration and some of the challenges that you were talking about there. I will touch on in some of my remarks this morning. So, just to start off with, the Care Quality Commission. What are we here for? What are we supposed to be doing? This is a slide that I am supposed to use every time I do a presentation. It is part of my key performance indicators. I'm sure you've all got them too. And so if you see David Bean after today, could you please tell him that I did it? But this just makes absolutely clear that we are here to make sure that health and social care services provide care which is high quality, safe, effective and compassionate, and that we encourage services to improve. And what's really important about this is that the way that we do that is through registering services, monitoring them, inspecting, providing information about our judgments. We don't deliver the services. We're not there on a day in, day out basis like all of you. So actually we have a momentary intervention way of working with you, and we need to make sure that we're clear about what the boundaries and limits in terms of the expectations for us are, and how that impacts on those of you who are delivering services and commissioning services on a regular basis. So it's a partnership, I think, and that will come through in some of the other remarks that I'm making. But despite the fact that this is my key performance indicator slide, and it makes it very clear what we're here to do, for me it feels a bit bureaucratic. You know, it's a lot of words. What actually does it mean? What does it mean to all of us when we get up in the morning and think about the role that we have in social care services? And this is what it means for me, and I hope for the people who work with me. It's called the mum test. It's not new, it's not original. It's actually about saying, is any service that we're going into and inspecting, would we be happy for somebody that we love and care for to use it? And if we would be happy for somebody that we love and care for to use it, then that's fantastic and we should celebrate it. And that's something that we don't do a great deal of in adult social care, is celebrating the good stuff that we know goes on. And that's one of the focuses for us at the CQC, is to find the good services and to make it clear that they do exist. But if it's a service that we wouldn't be happy for our mother, father or anybody else that we love and care for to use, then it's not good enough for anybody to use, and we need to do something about it. And the way that we go about this is to ask 5 key questions of all of the services that we're looking at. And these questions apply across health and adult social care. So we're first of all asking, is the service safe? Do people feel safe? Are the staff supported to respond appropriately to safeguarding issues? You know, are we managing risk in a way which is proportionate and appropriate? Is the service caring? Are people treated with dignity and respect? Something that we all know we would want for ourselves and we would want for our loved ones. And there's a quote I sometimes use from Maya Angelou, which is, you know, people will forget what you said, will forget what you did, but they'll never forget how you made them feel. And that's really what we're trying to get at in terms of asking, is the service caring? Is the service effective? Does it do what we are actually intending it to do? And this is an interesting question for us in adult social care. And mindful of one of the issues that was raised from one of the delegates on the floor in the last session, that, you know, focusing on what's meaningful for people, whether they've got a physical disability or it's an older person living with dementia, you know, is interesting. So are we enabling people to live the meaningful lives that they want to live, you know, regardless of whatever it is and their support and care needs are? We also know that in social care we are in the main, working with people and impacting on them in all aspects of their lives. You are providing services to people in their own homes. It has a tremendous impact as to whether that service is good or whether it's not so good. But we also know that people's needs will change. So another important question for us is the service responsive? Is it actually responding to the changing needs of people and taking into account the fact that a quick pop in for a medication check may be all well and good, but actually if that person is feeling anxious, depressed and lonely, then that's not the way that we should be delivering that service, and we need to be responding to the needs of individuals as they change. And then finally, and very, very importantly for us, is the service well led? And for me, this is one of the absolutely critical questions for us as inspectors, because we're not there, as I said before, day in and day out. So sometimes when we see quality, we want to know whether that's going to be sustained. If we identify that improvements are required, then we want to know that there's the capacity and the capability to deliver those improvements. And it's the culture and the leadership and the management of the service that will give us the confidence that quality can be sustained or improvements can be delivered. So asking the question about whether a service is well led is absolutely critical. And taking all of that information together allows us to make a judgment as to whether this is a service that we think is a quality service, is a good service, and is one that we would want our loved ones to use. And I've called it the mum test because I get to use a picture of my mum. This is indeed my mum. This was a photograph taken of her on my wedding day. And it had taken me nearly 17 years to get David to marry me, so she was pretty darn happy when I pulled it off. And that's the way that we want people to be looking when they're using services across the whole of the health and social care system. They may be in difficult circumstances, they may be having a tough time, but we know that adult social care can transform people's lives for the better, and we want to be able to achieve that, and we want to be able to help you to do that. So taking the fact that we can transform people's lives, we do have to recognise, and I think that the session earlier this morning really emphasised this, adult social care is incredibly challenged. We have high expectations of the services that are being provided. Demand is rising, and the needs of the people that you are caring and supporting are much more complex and increasingly more complex as time goes on. Resources, as we heard, are incredibly constrained, and the level of scrutiny under which we all operate is intense. And we need to be able to respond positively to that, but it does, of course, put us all under a very, very sharp spotlight. So how do we respond to all of that and ensure that we do deliver the quality services that we know the people who are using home care services have every right to expect? And I think that we have to actually follow on from the very final comment that was made in the last session, which is the plea for collaboration and to work together, because we can't individually crack the problem of quality services without working with each other. It's absolutely critical that we have staff who really do care, who are supported to provide services in a way that is safe, compassionate and high quality. But there's a really important role for providers in how they organise themselves, how they use the resources that are available to them, what they focus on, what they do in terms of training, support and development. And commissioners don't get let off lightly either. One of the great challenges that I always have is that we're coming after the wrong guys in terms of identifying problems in home care services. And we should really be looking at commissioners, because you know as well as I do that commissioners have an influence on the quality of the service that can be provided for good as well as for ill. Regulators do, of course, have a role. We are here, I think, to make sure that we're setting clear expectations of what we're expecting to see, and monitoring those and providing information for people that says whether we are seeing quality services or not. And of course, the general public has a role to play. And here I think that this is particularly important in social care. We hear an awful lot about the NHS and the needs of hospitals and the bricks and mortar that are associated with that. We hear much less about the absolutely amazing work that does happen to support people in their own homes that you and your staff do on a day in, day out basis. And we need to make sure that collectively we raise the status of adult social care, both in terms of our focus and our valuing of it, but also our support for it. And that will also have an impact on quality. Each year at the CQC, we are expected to provide a report to Parliament to let them know what it is that we've been seeing in terms of the quality of care. And we published our State of Care report in October 2014. And the major headline, and this was across all services, but the major headline was that we found many examples of good and outstanding care, but the variation in quality is wide. We can see cheek by jowl, great care in some services and very poor care elsewhere. And we need to narrow that variation, and we need to make sure that we're encouraging those services that are at the lower end of that variation to improve. So our new approach, which we've been working on over the last year, is focused on an operating model that I've set out here. So first of all, registration, a rigorous and a robust test that makes it absolutely clear to people what are the legally binding commitments they are signing up to at that stage. This is particularly important, I think, for this audience. There's an awful lot of people out there who think that they can run a domiciliary care service and haven't got a clue what it is that's actually involved. And we have a really important role to rigorously test that and make sure that only people who can have the capacity to deliver high quality care come into the market. We across all of the services are wanting to look at what information is available to allow us to identify when we should be inspecting services and what we should focus on when we're inspecting those services. My colleagues in health, so Mike Richards for hospitals and Steve Field in primary medical services, are blessed with a lot more information and hard-edged data than I am in adult social care. But that doesn't mean to say that we don't have anything. We do have some information. There's information that employers provide to the Skills for Care on employees. There's information that we get from local authorities around safeguarding notifications. There's all sorts of things that we can use. But very importantly, we also need to be listening to the voices of people who are using services and their carers and relatives, and that helps us to identify when we should be going into services. Doing our inspections, we now have an Adult Social Care Directorate which is just focused on inspecting services that are providing adult social care. So that means that you will have expert inspectors supported by specialist advisors if that's appropriate, and also by experts by experience, people who've had a personal experience of care who can bring that experience to bear on the inspections, which will be focused on those 5 key questions. And we will report on that by identifying whether we think the service is good or outstanding, or inadequate or requires improvement against each one of those individual questions and against the service as a whole. And if we think there is action that needs to be taken, then we will take that with you. But equally, if there are improvements that you can make that will take you along the trajectory from requiring improvement to good to outstanding, then we will identify that as well. We've been developing these changes over the last year, working in partnership with people who have been using services, their carers and families, critically though with providers and with commissioners. And at this moment, I'd just like to pay tribute, in particular, to the UKHCA for the role that they've played in helping us to shape and design the new approach. And in particular, Colin Angel, who has been a very regular attender at our external co-production groups and has done a great job on all of your behalf, but supported by the rest of the team at UKHCA. And also thank you to those of you who have been involved in the various workshops and the pilots of the testing that we did. So we've published our key lines of inquiry and the characteristics of the ratings and our provider handbooks. So you can see, and it's all available on the website, what it is that we'll be asking, what it is that we're expecting to see, and how we're going to go about doing that when we come and inspect. The new regulations will come into force in April next year and will continue to underpin that new approach. And there will be new regulations around the fit and proper person requirement and duty of candour. And we are aiming to rate all of adult social care services, which I have to say is 25,000 locations, so it's not a little ask, but we're aiming to do that by March 2016. We have started to publish our ratings, and as of Friday last week, what's encouraging is that of the first 90 that we've been publishing, 73 of those services are good. We're yet to have an outstanding service, and we will definitely be celebrating that when we do. But I think, given that it is 25,000 locations overall, this is way too early to suggest that this is statistically significant. And we'll keep you up to date with how that is going. In terms of encouraging improvement, I do think that this is a very important role for CQC in actually signposting people to the resources that are available to support the action that you may need to take once we've shone the spotlight on what you're doing. So, there's an enormous amount of support available from organisations like Skills for Care, NICE, and the Social Care Institute for Excellence, which as Richard has already shared with you, I should declare my interest as having worked for both of them in the past. But there are other professional associations like the occupational therapists and indeed the college in which we're doing the conference today and providing information for us. But we don't let the grass lie underneath our feet. There are still things that we need to be doing. And I think it's fair for me to share that there are continuing challenges for the Care Quality Commission in embedding our new approach and ensuring that although we've been very clear about what the key lines of inquiry are, what the characteristics of our ratings are, we need to make sure that the judgments that our inspectors are making are consistent and reliable across the country. And we're doing that by supporting them through training, through working with providers so that you know what good looks like, but also in having quite a rigorous quality control and quality assurance process supporting the publication of the reports. We do have a challenge, particularly at the moment, around the timeliness of those reports being published. And that I think is partly to do with people learning a new way of doing reports, but is also to do with that quality assurance and quality control that we've got in place. But we are ramping that up now, and I think that you'll start to see those numbers of reports coming out much more quickly than you have been to date. The intelligent monitoring for adult social care is a challenge, and we need to be doing more around gathering the information together and finding out what it is that somebody who's going into somebody's home and the individual who is using services, and really getting underneath the skin of those services is difficult. I think it's difficult for people who are running the service as much as it is for us. We have a new responsibility which we're taking on board next April, a market oversight of some of the larger providers, those providers where it would be extremely difficult to re-provide those services in the event of provider failure. And we're We're not there to stop that failure happening. It's about spotting it and making sure that appropriate arrangements are being made to ensure continuity of care for people using services. And last but not least, we have a special measures regime to work with you to develop and to link that with our existing enforcement roles to take that forward. So I think there are challenges for all of us. But I think that what's really important, and UKHCA, I think, really buy into this, is that we're only going to make this happen, we're only going to reach that ambition of social care, providing services we'd all be happy for our loved ones to use, if we stand up for adult social care together, if we celebrate the good and challenge the bad. But we have to be positive and honest with each other and to work together. And I think finally, as was being said in the last session, we do have to remember why it is that we're doing this. We can only make the mum test real if we focus on the people who are using the services, focus on responding to their needs and ensuring that they are getting the service that they have every right to expect. So that's the end of my remarks, Bridget. If you liked any of that, you can follow me on Twitter at CrouchEndTiger7, and I write a weekly blog which keeps you up to date with everything that's going on at CQC as well. So thank you very much.